And when it is that we should go, like how we have a second opinion in doctors, like,
Correct.
okay, if this doctor is not able to diagnose, we go to another doctor. Similarly, when do we decide if we need to do investigation from another lab?
Right. So primary thing, Dr. Keyur, we all need to keep in mind that there are a lot of physiological fluctuation in any parameter you take in the body. Okay, it can be sugar, it can be your hemoglobin, it can be your cholesterol. So for every parameter, there is at least 10 to 15% of fluctuation which happens on a day-to-day basis. Every day it is going to be a little different. So when you tell me that, say for example, on one day the cholesterol was 200, and you go to a different lab after a couple of days and you say that the cholesterol was 180, okay, it means the same. Okay, because it is not that the lab results are different. The results are different inside your body. There are changes physiologically happening and the parameters are fluctuating. Okay. Now, if you suspect, okay, you have one of your patients who comes up with a high cholesterol and you feel, okay, it cannot be so high, I have put in home treatment. Okay. So what things you need to keep in mind when you are looking at the report? First and foremost, where the report has been done. The report should be done at a standard lab, a well-reputed lab, and which is monitored by a pathologist, right? Number one. Second thing is, it is preferred to have the reports done at an accredited lab. Okay, some accreditation like CAP or NABL, okay, should be present preferably. Okay, if these two criteria are fulfilled and you are still suspecting, okay, maybe there is something wrong with the lab report, then go to a similar lab with a similar standard. Okay, don't go to a lab just around the corner because it is convenient. Okay, because we don't know what kind of work is happening. So always pick up a standard lab, and if you're still suspecting, okay, you can refer the patient to another standard lab of equal repute. There is one more third option, is that you can tell the patient to get the repeat investigation done. That you can talk to the lab directly that, you know, this particular patient has shown so and so result. Okay, but I'm not expecting this. Can you just recheck? Okay, the lab will be more than happy to collect a fresh sample and get it done with themselves.
Right. So even this kind of communication can be done.
Yeah, this communication has to come from doctors. You know, basically what happens most of the time, that the doctor would say, okay, this doesn't look right, you get it repeated at some other lab. Okay, it is still possible that the result is correct. So just pick up the phone, speak to the lab, and they will be happy to recheck it for you.
Like that blood sample is still there with you, it is viable for some time, and therefore you can use the.
So blood samples are usually for these parameters, they are kept for a day. Okay, if it is beyond that, then we will have to collect a repeat sample.
Right.